Hello and welcome to RCA Radio, a podcast where we cover the latest news and challenges in regulatory, compliance, and quality assurance facing the life science industries. I'm your host, Brandon Miller. In this episode of RCA Radio, we'll be taking a dive into cybersecurity for medical devices, and we'll talk about some of the challenges that are associated with managing your security. Today, I'm joined by Jason Tugman, a medical device cybersecurity subject matter expert here at Regulatory Compliance Associates, and Mustanir Ali, a certified manager for digital and connected products at BSI. Thank you for both joining me today. And before we get started, would you both mind sharing some of your background with the listeners?
Sure. My name is Jason Tugman. I've been in healthcare, specifically medical devices, for about 15 years now. Prior to that, I was in the energy sector, doing a very similar role, just within that regulated environment. And then prior to that, I was working in research in Washington, D.C. At the MITRE Corporation.
Cool. Thank you for having me. So I'm an electronics and software engineer by background, but I've spent the last 15 years working in regulated products, mainly with a focus on CE marking and access to the European and now UK markets. That journey has taken me across many product spaces, including medical devices, as well as software-based and connected devices, which has led me to focusing very much on cybersecurity and the developments in the various European and US frameworks over the last couple of years.
Amazing. We're excited to have you here today. And today we're going to review cybersecurity in medical devices and cover some of those recent guidances that have come out, the major gaps that companies' products face, and some tips for companies that they can use to address those gaps. So to start off, most people by now are aware of what cybersecurity is now that we live in such a connected world. Could you briefly explain what is cybersecurity in the healthcare industry for the listeners?
Yeah, sure. From my perspective, it all comes down, being U.S. based, and I'm curious to hear what Mustanir has to say about the U.K. But, in the U.S., it's just all about definitions. The FDA has defined what a cyber device is. We can look at cybersecurity, in our personal lives, strong passwords and that kind of thing that we all know, and those relate to medical devices. But the ante is upped when we're looking at a connected cyber device, which we can probably define in a little bit, as defined by the FDA. And that has a whole new branch of requirements and needs, both pre-market and post-market, and your post-market surveillance. And so the things that we do in our daily lives, even in our corporate lives from a cybersecurity perspective, there's a brand new set, a whole different set of requirements that are very specific to medical devices.
Yes, I would agree with Jason here, actually, that the cybersecurity is a word we throw around a lot and we hear about a lot. Over here in the UK and Europe, it's actually something that is people struggle to define. Cybersecurity is a property of devices that have connectivity, a property that we hope they have. And fundamentally, whether you're talking about a medical device or indeed many other types of devices or enterprises and businesses, cybersecurity is all about protecting things that are connected to mainly to the internet from risks and the dangers of being connected and what you could say unsavory characters could do with that connection. Fundamentally, the difference, though, that occurs between product types and sectors and the difference then that medical devices have versus other things is about the context of their use, the networks they're connected to, and the risks associated with what could potentially go wrong.
Okay, now that we've got those basics covered, what are some of the recent guidances that have come out from the FDA and the other notified bodies in the EU in regard to cybersecurity, and how are they impactful to the industry?
So in the US, we've had, I would say, two major releases and a minor release. 2 years ago, the FDA actually included in the federal omnibus, section 524B, B1 for anybody that is nerdy enough to look that up. They actually codified a lot of now not regulations, which are largely, or guidances, which are largely like should statements, into regulations, which are shall statements. And these are things like making sure that you now are required by this law, and omnibus is a law, to have a coordinated vulnerability disclosure program to have an SBOM, which is a software bill of materials, which is a major gap for a lot of companies right now. So that was the omnibus. Then we've got, in January of this year, we have guidance that came out from the FDA on AI. So this is our first AI regulation. What I really love about this regulation is that Suzanne Schwartz and those people at the FDA who are heading this, they followed the EU, and the UK followed the EU, and then we are following the UK. And so we all now have a global presence on what it is to have AI in medical devices. And between the US, UK, and EU, we're all largely in alignment, which I think is fantastic. And then lastly, we had our final, so this is the final version that we've been working on since 2019 of our pre-market guidance, cybersecurity requirements for pre-market. And that came out in June 2025, so just a few weeks ago. And that had some significant updates. In it redefined what a cyber device is, or it strengthened its definition of what a cyber device is. It now requires that we have a vulnerability disclosure program in place prior to market acceptance. We must have vulnerability traceability matrix prior to release, and a lot of other smaller requirements that can be quite confusing, to be honest with you, because a lot of things have changed so much in the past 2 years. And I think that's kind of where people like me and Mustanir come in. We're the people that sit back and we read all this stuff, and it's our job to know what's changed, what hasn't changed, and what we think is going to change in the future.
Again, I can only echo what Jason's saying here. I mean, in an interesting sort of twist, I would say that the latest guidance from the FDA actually sort of moves the US position ahead of where we are in Europe. So we are currently relying in Europe on sort of the existing medical device regulation and in vitro diagnostic device regulations, which do have their cybersecurity requirements that have been in place for many years now, actually. And the guidance document that everyone leans on is from a group called the Medical Device Coordination Group, or MDCG. And they published something back in 2019 on how to approach cybersecurity for these regulations. So the guidance document is under review at the moment. It's already 6 years old. What we see with the latest FDA guidance, though, is that has moved on and actually aligned itself very closely with a newer piece of legislation in Europe, which is the Cyber Resilience Act, and touches on a lot of similar topics. Although what's interesting to note is that the Cyber Resilience Act does not include medical devices in its scope. So we're in an interesting place in terms of the regulations, the requirements, and the guidance available.
That's very interesting to hear, and it's exciting to hear that it seems that between the FDA and the EU notified bodies that there is some alignment there, and let's hope that they continue to have alignment to make things easier for companies. With all these guidances, it sounds like there are a lot of places, though, that companies can fall short. What do you believe are the top 5 gaps that these companies face with cybersecurity?
One of the things that I get to see in my time working here at RCA is that I have the ability to work with a lot of small and medium-sized organizations. These are people that have maybe no products on the market or are in the early phases or sometimes late phases of updating a grandfathered product, so a product that's been out for more than a decade before a lot of the stronger cybersecurity requirements have come in. And one of the things that I see all too often is that they start too late. Cybersecurity is not something that you can any longer swim upstream on. In other words, hey, we're 4 months out from our submission. Let's contact RCA and have them do our cybersecurity for us. I'm sorry, you're too late. There are requirements that in and of themselves can take 3 or 4 months. I'm looking at threat modeling, the SBOM, the new SBOM requirements. In fact, the updated SBOM requirements, which now are not looking at just, your device. So an SBOM, software bill of materials, which I would consider another gap for most organizations now. The FDA clarified in a roundtable in December at the Health ISAC conference that, before we used to get away with just doing the firmware that is in our device, kind of that top level, the stuff that we make or the libraries that we intentionally put in. But now I describe it as turtles all the way down. They want all of the components of components of components of components. And so now we're looking at SBOMs that 2 years ago, I submitted an SBOM for a class 2 device that was probably 50 lines long. That same device today would probably be 1,500 lines. So we're now looking at, we need machine readable and human readable formats now, which is a new requirement. So there's a lot of things that we can't do just, at the last minute. And then we have to go through, penetration testing, and then we have to fix these things. We're not going to get market acceptance if we've got highs and criticals in our SBOMs, in our, in our vulnerability traceability matrices, or our penetration tests. We're just not going to do that anymore. Those days are gone, dead, and done. And so that number one gap would have to be starting too late. Really, you should be talking to people like RCA and others. A year out is a good time. 8 months is really stretching it, especially if you're a small or medium-sized company where you don't really have that internal staff to be able to react to some of those things that need to be not only identified, but remediated prior to your submission. Those would be the gaps that I would identify immediately.
Yeah, and at risk of not being very exciting and starting an argument, but I really do agree with Jason. I think that starting too late, or for some organizations, another challenge they have that's related to this is bringing an existing product into the newest regulatory frameworks that perhaps was designed in the, I dare say, bad old days of when device developers and manufacturers were adding connectivity and these functions to, I would say, traditional or non-connected devices because they can. And maybe there was some cool use case that they've come up with that they would add this functionality, knowing that in the past it was unregulated, so they would add it, it would work. And now you're taking those products that may be quite mature and having to now go through that regulatory cycle. And again, the product's already been developed and you're dealing with these legacy products. And that can be challenging because it's difficult to go back and redo some of the work that really should have been done at the start. And there are aspects of the framework and the guidance that it was difficult to sort of bolt on later. It sort of wants to be there from the start. So that's a challenge, but also is a gap that needs to be addressed with if you have existing products that are being brought into the new regulatory frameworks, especially in Europe where products do need to comply with whatever sort of legislation is in place at the time it goes to the market. And that's a particular device, not a design or type of device.
So with these gaps that you guys have identified, what do you guys think companies could do to start addressing these and mitigating them? Obviously, preparation is key, but what are some things that companies can do to help get ahead of these? And or again, are there tools that people can use? What would you recommend?
So the FDA is really pushing the idea that threat modeling is the second activity you do when developing a new product. Step one is design or document the features you want in your device. Step two, perform threat modeling. Threat modeling is what are we going to do or what are we doing? What can go wrong? What are we going to do about it? And are we doing enough? Right? Those are the 4 steps in threat modeling, very simply put. So threat modeling comes second, and then your design specifications, which then can support those identified threats and risks for the features that you want to do. So your features are, what do I want to do? My threat model then asks, what can go wrong and what are we going to do about it? And then your design specifications are, documenting, putting those things into writing that we are going to code scan, we're going to authenticate, we're going to encrypt, we're going to X, Y, and Z. And therefore, you don't have to swim upstream. You're doing that work early. A great example is I'm working with a very small company, and they've got a product. And actually, just as Mustanir said, they're actually updating this legacy product. And they came to me, and they're very early on. So they're about 1.5 years out, almost 2 years out from their submission. So we're working with them at a fantastic time to be integrating with as a partner. And they asked me, they said, Jason, we're okay if we have to redesign the box. So here's everything that the box currently has. What can we do to remediate cybersecurity early? And I love that question because far too few people think about this. So the FDA pays attention to Wi-Fi, they pay attention to Bluetooth, they pay attention to radio frequencies, they pay attention to USB ports. And if you've got a USB port that is exposed, plan on that thing being under a microscope. Now, what if it's a service port and the only service that happens is not in the hospital or not in the doctor's office, but back in your factory? Then why have that USB port exposed to the world? Go ahead and put a little door with a little security screw. You're still going to put, your pins and stuff on the service port to make sure it's read write and all that stuff. But that one simple thing, it increases the complexity of the quote attack. And the way that the FDA looks at things is we're unlike safety risk, right? So your FMEA, which is safety risk, which is probability based. Cybersecurity, as of 2 years ago now, and then again strengthened again in the 2025 release of the FDA guidance, we are exploitability based. How easy or how hard is it to exploit the vulnerabilities? And so if I've got a vulnerability in that service port, well, I've just increased the complexity, therefore, reduced the exploitability by just putting that service port behind a little door with a security screw, that one little step. And so this client is thinking about this so proactively that it's exciting. And by the way, if you can do something in a physical control, you have to do that once, one and done. But if you have to do it logically, you have to do it again and again and again. And every time you update the software, you have to make sure you didn't change that software-based security control. And that one simple thing, it's that early and often, but it's following that guidance, the features, then threat modeling, then your design specifications, and think about what you can do to reduce your exploitability, your impact, your harm through physical means, through non-logical means. And that will actually reduce your R&D. It will reduce your software overhead. It will reduce, penetration testing costs and all these other kinds of things. So you can actually greatly reduce even the maintenance of that code or that firmware. Can go down because you've got these physical things, these alternative controls in place that aren't just relying on logical, that is programmable controls.
It sounds like you've got the right kind of client, Jason, sort of the people who are looking at this early in their development life cycle, which is really the best thing that anyone can do as a product or device developer is to get in early, think about this stuff early, and really embed it into their product development life cycle and processes. The guidances and frameworks talk about things like a secure product development framework, which is also reflected in the European standards and guidance as well. And I really like this discussion around, for example, closing off as a physical ports like a USB port or a service port, because it really makes me think about another source of guidance for product developers, which is standards. And there are various standards out there, European standards, US standards, ETSI standards, you name it, from all kinds of organizations that ultimately try and address best practice controls for connected devices. And even if these standards don't necessarily address medical devices explicitly, what I find is that whether we're talking about industrial control systems or consumer connected devices, actually you see the same controls come up again and again and again. Things like encryption, things like, making sure that security assets and network assets are protected by authentication mechanisms, things like not exposing unnecessary ports or disabling the debug ports and debug features in the release versions of devices. And you can almost treat these standards as catalogs of things you can do to address risks. So that would definitely be my advice, is look at standards, because the work is being done by a lot of people out there to define good practices and best practices that hit the most common vulnerabilities.
So say I am a company that's larger and I have a established connected device in the industry. What would you recommend them to help mitigate some of the risks with these new guidances that are coming out and address some of those gaps they might face?
Trying to see if I can talk about this without naming them. I'm working with a very, very large medical device company, very established global company. they've got a product that's been on the market for about 20 years, and they did a major update to it, like a V2 kind of thing, big update. And they thought that they were good because it was already a cleared device and they only did some minor changes and it wasn't a big deal. They didn't really add much functionality. They just, kind of updated, to more modern type of solution. But the device itself is the same box. It's largely the same PCB boards and those kinds of things. And they were flat denied by the FDA. Not an AI letter, just a flat no. And it's because that legacy device didn't have so many of the things that we now consider to be standard. Code signing, again, authentication, the ways of detecting. Can the device detect? Can it log and monitor itself, especially if it's got an OS on it? How you do your OTA, over-the-air updates, things of that sort. And I had to give them, frankly, unfortunate advice to say, you need a bigger budget in about 4 more years. That didn't go over well, but it was true. And I think that the thing that a lot of larger organizations think is, well, the device has already been on the market. This is a minor update. This should breeze right through. But because you're going through the system again, they're not looking at, oh, well, it's already cleared, it must be okay. They're looking at it through the fresh eyes of the fresh guidance. And a lot of the larger organizations, I think they've come around now. I think they've understood that now, the larger organizations. But just because your device is on the market now does not mean that it will clear. Even if it's a class 2 device, which this particular one was, you just can't, you have to meet today's standards, regardless that grandfathering doesn't really exist. And I think a lot of organizations are coming to that understanding and understanding that to update that device, it's not a simple patch. It is a potential capital project for that larger organization.
Yes, and I would only add to that I think it's worth remembering that the all of these requirements around threat modeling, penetration testing, remediating those risks and vulnerabilities that are identified can and should be taking place on an ongoing basis throughout the life cycle of a product. So if a product already exists and has been developed as a so-called legacy product, there is nothing stopping a manufacturer or device owner going through that process on the as-is device and then doing the necessary development update work that's necessary to bring it into scope. And as Jason says, that may have more cost implications than maybe the developer would like, but that is sort of how the guidance and everything is framed, which is that this is an ongoing thing because cybersecurity moves. A product that's secure today may not be secure in 2 months' time, and it has to be continually under review. So it's just that the gap is bigger if you're coming from a position of non-compliance into compliance, if that makes sense.
We have to remember, and just building on what Mustanir said, I totally agree with him. We have to remember the whole reason that the FDA started and released their new, what is now released in June 2025, it started in 2019. And the impetus of that was, one, recognizing that cybersecurity 10 years ago is not cybersecurity today. But 2, and most importantly, it was to tackle the problem of legacy devices. Hundreds of thousands of devices are in hospitals that are unable to be updated, unable to be patched, because we just weren't thinking about that back then in the day for security purposes. So a massive reason, I would say 80% of the reason that we even have that 2019 and then that, 2022 and now the 2025 guidance, which is all the same guidance document, just updated. The whole reason for that was to tackle the problem of the cybersecurity risk within hospital networks for these legacy devices, the unpatchable devices. And so that's why we can't just take an old device and chuck it back through the system. We have to put these updated capabilities in there, around updating. How are you going to monitor it? How are you going to maintain it? How are you going to patch it? How are you going to secure the device today and tomorrow and into the future? And again, that's the main purpose of why the 2019 guidance even exists, and now the 2025 guidance.
It sounds like companies have a lot to look out for as the industry continues to evolve and as we're introducing more connected products into the market. As we wrap up today's podcast, what would be the main takeaway that you'd want the listener to know about the cybersecurity landscape?
It's no longer plug and play. You no longer have the option of bolting on at the end. You just don't. There's too many complexities. Class 2, certainly Class 3 devices, Class 1 devices, we can talk about. But, we can no longer just consider cybersecurity at the end. Financially, we kind of wish we could because it would be cheaper. But in fact, it's actually far, far, far more expensive to consider cybersecurity late in the game. And again, your timing, and the FDA has gotten very smart. I have seen the work that Dr. Kevin Fu has done. I've seen the work that, back in the day, Seth Carmody did, and, obviously Suzanne Schwartz and all these other people at the FDA. They have done an enormous and an amazing job of training their reviewers, kind of to our detriment, because they're now really smart. We used to kind of get away with some sneaky stuff and, our SBOMs are pretty short. Those days are done. Those days are long gone. And so if you haven't put a device through FDA in 2 years, it's not the same process. It's just not, and I do maybe 25, 30 submissions a year for various clients. And I can tell you in the past 3 years, I have seen the FDA, quote, get smart. It's a pleasure to watch, but it does make my life a little bit more difficult, and certainly the manufacturer's life a little bit more difficult. But it's not the intent of the FDA, but it is the purpose of the FDA to make sure that these devices are in fact secure. And they've gotten very smart on how to check and double check that is now the case.
And I think I will make 2 points, really, just to add to that as sort of key things from what we've discussed today. The first is, if you can, get in early. Start thinking about cybersecurity and embedding that in the design process and the design thinking early as you can, because it's not a plug and play. It's got to be designed in to products in order to meet these requirements. And the second point is also what we touched on at the start of this session, which is the interplay and the similarities and the alignments between what's going on in the US with the FDA guidance and the European guidances and the UK requirements as well, because actually there is a lot of alignment. And what you don't want to be doing, especially if you are accessing multiple markets, is taking a fundamentally different approach for each market. The more you can effectively achieve with the same set of work, the more streamlined and efficient things are, and the easier it will be.
Yeah, and just the final point that I would make, and don't go it alone. The world has changed. And again, these small and medium-sized companies probably don't have a full-time cyber person on staff, much less a full-time cyber person that specializes in, US and global market cybersecurity requirements. So whether you work with companies, like ours, like RCA or somebody else, I just say don't go it alone. It's changed so much. It's hard for me. This is my full-time job. I lecture on this topic. I speak on this topic. It's hard for me to keep up with this topic and the changes, especially globally. So having these global partners in the UK, in the EU, and in the US, don't go it alone. I think it will cost you more in time and resources to do that versus working with, a firm or firms that truly specialize in making sure that your device is cyber secure.
That's fantastic. And again, preparation. I'd like to thank you both, Jason and Mustanir, for taking the time to talk about cybersecurity and connected devices and some of those challenges that companies will face throughout their product's lifecycle. And I also want to thank our listeners for tuning into this episode of RCA Radio. Be sure to subscribe to be the first to know when we upload the next episode of RCA Radio. Thanks again, and have a great day.